Good morning. So my name is Alicia McCarthy, and I'm the nurse practitioner with the Spine and Scoliosis Center at Nemours down in Wilmington, Delaware. And although I have not taken home a child myself who's had a spine fusion, I promise I'm not a complete fraud. We do this surgery many times a week, and so I'm constantly talking to parents, giving advice, but also getting advice. So the vast majority of my presentation is actually information that families have given me. So when your child first comes home from the hospital, for the first few days, they're pretty similar to what they were like in the hospital. So their pain level's about the same, their activity level should be pretty similar to what it was in the hospital, but we don't want them hanging out in bed all day. We do want them up, participating in family life whenever possible. We tell our kids no bed unless you're sleeping, and that you should really be focusing on getting your kids back to normal as soon as possible. Most kids do need a parent home with them or someone with them to help for the whole first week that they're home from the hospital. And then after that, they can be home as needed, maybe a phone call away. One of the biggest things that families need to focus on is getting their child off of those pain meds that they go home on. Most of our kids are going home on Percocet and Valium. We tell them to stick to those meds on their regimen for a few days after they're home and then start weaning them. So you can wean by the pain medication amount that you give with each dose, or you can increase the amount of time in between doses. Often what I tell families is if your child's getting a tablet and a half of Percocet, give them one. Wait 30 minutes. If it goes well, great. If not, you can always give that extra half tablet, that's fine. And each tablet of Percocet has 325 milligrams of Tylenol in it, so you can always just try a plain Tylenol instead. And obviously extending the time in between doses, so instead of every 4, see if they can wait until 5, 6, or more. There's a lot of non-pharmacologic or non-medicine ways you can relieve pain, so activity and walking is incredibly important. I tell our kids that their back is like having a Charlie horse after surgery. What's the best thing you can do for a Charlie horse? Move. And so that's what these kids really need to get their muscles back to normal, and these medicines are just a bridge to help them until they get there. Heat or ice, some kids really prefer one over the other. Some kids love massage, other kids will say don't touch me, and that's completely fine. Music or any sort of distraction that you can think of is completely fine, because some of this is just time. Kids need time to get better, and so whatever you can do to get them there is okay. I tell our kids they need to be walking many times a day, at least once in between every pain medication dose. And the house is great, but also get them outside. Go to a local track, or the mall is fantastic because it's flat, it's warm, there's lots of benches, and there's some pretty good distractions too, and I bet your parents might buy you something there. They can shower before they leave the hospital and should continue to do that at home. You just have to make sure they're not dizzy, so having someone an arm's length away is really important. You can allow water, shampoo, soap, everything to just run down their back. Don't scrub the incision, but you can rub their back, that's fine. And just don't submerge the incision. Don't put them in a tub until after you've been cleared by your doctor. Constipation is a problem for every single patient. It's just a matter of to what degree. So make sure if they're on medicines for that in the hospital, make sure they continue those at home because they're on the same medicines that they were in the hospital. And I always tell our families to monitor constipation. The biggest problem I think we have is that parents aren't used to asking their kids when they last pooped. And so sometimes it's 4 or 5 days before someone's realized that this is a problem, and then I'm getting a phone call and we're trying to clear someone out at home, which is pretty uncomfortable. And just know that nighttime can be tough. So kids are distracted during the day, they're up and moving, and that's great. But at nighttime, your muscles are tired, you don't have those distractions, everyone wants to sleep. And so just going into this expecting that nighttime can be tougher than daytime, I think that really helps. We want our kids back to normal in the first month. So this is actually one of our patients who decided to go to prom 1 month after surgery. She wasn't planning to and decided to at the last minute. You should be completely weaned off of pain medications by the time you come back for your 1-month post-op visit. Ways to finish doing that, figuring out that one medicine may help more than others, so get off of those other meds first, and then focus on that one last medicine. Transition to plain Tylenol instead. Really emphasize all of those non-pharmacologic pain relief measures. And again, expect that nighttime pain medication dose to be weaned last. It's okay for kids to be off of things or nearly off of things during the day, but still need their full pain medication dose at night. That's okay. It doesn't mean you did something wrong. Moving and stretching is incredibly important. Going back to that Charlie horse example, kids can bend and twist as much as they want under their own power. I don't want their friends jumping on their back, but if they get down and tie their shoes, that's what we want. Trips out of the house are a great distraction and help to increase stamina as long as there's an out. So they can go to the movies, go out with their friends, go to school, as long as they can make a phone call and someone can come pick them up. I don't want them somewhere for 4 hours and then they realize after 2 they're done. Back to school, ways to help do that. Practice sitting in a harder chair at home. Often a dining room chair is good. Sorry. We tell kids to start expecting to go to school with half days and then work up as you can. You can use pillows to help you sit in those hard school chairs. You can move around and stretch in the back of the classroom. For safety reasons, we do always have our kids leave class a few minutes early, have a friend carry their bag, and obviously avoid gym and sports when they first go back. For that second month recovery, their muscles are much better healed. Kids really start to feel like they're back to normal. We let our kids start jogging if they want to, 6 weeks after surgery, and that's also when they can start driving, with the caveat that they need to be off of their pain meds and their muscle relaxants. At the 1 month visit is when we often consider physical therapy for kids, and I think there's really 2 groups of kids who benefit most from PT. The first is kids who need someone besides mom and dad to give them that extra confidence or that extra motivation to get up. And then our second group are high-level athletes, kids who are looking back to getting to something as soon as possible. And so that's when we allow them to start doing their sport-specific exercises and training. By 3 to 6 months, kids feel great. I am often pulling them back from things that they want to do because their bony fusion hasn't yet occurred, but their muscles feel good. So I tell our athletes to focus on your conditioning, focus on your non-contact sports and your drills so that when you're allowed to go back to everything you want to do, you're in better shape than you were before. And by 3 to 6 months after surgery, all of our kids return to everything that they want to do. Obviously, that is dependent on bony fusion, their bone density before surgery, and it is somewhat surgeon dependent. So ask your surgeon what is right for you guys. But all of these are pictures of kids, our patients, doing things 6 months after surgery. A few things that I've picked up from parents. Parents tell me that it's like bringing home a newborn. Your child is going to need you in the middle of the night where you probably haven't had to do that for a while. They're going to need assistance with things that they may not have needed for a while. You're going to have to pay attention to when they poop. And they're probably going to be a little more weepy than they were before. I find that the kids who do best and the kids who get back to normal fastest are kids who have a goal or some source of motivation, whether it's getting back to a sport, going to a dance, having a date. All of those things seem to really help kids get better. Don't hesitate to rely on family and friends. This is a marathon, this is not a sprint, so if people want to help you, take them up on it. And finally, encourage our teens to do everything that they can for themselves. So I always like to see our kids tying their own shoes at the 1 month post-op visit and being able to dress themselves whenever possible. And finally, ask to speak to someone who's been through this before. As much as I like to think that I know what I'm talking about when bringing a child home, again, I haven't done it, and most of these surgeons haven't done it either. So ask to speak to a mentor. This is a group of our mentors and mentees who get together every year to talk about the realities of what it's like to go through this. And I think all of our families find this really valuable. Thank you.